Tetanus is a severe bacterial infection of the nervous system in where an individual gets muscle spasms that begin in the jaw and progress throughout the body. Tetanus kills over 500,000 people every year. According to Healthline, 10 to 20% of tetanus cases are fatal. It is caused by a type of bacteria called Clostridium tetani that is found in animal feces, dust, and mainly soil. Countries that have hotter and wetter climates have a higher rate of tetanus due to the fact their soil contains more organic matter, such as bacteria. The spores, which are a dominant form of this bacteria, are resistant to heat and many antiseptics such as phenol. This bacteria enters the host through a deep wound or cut. The bacteria is anaerobic, meaning it flourishes when there is no oxygen present. This is why the bacteria is dangerous when it enters a wound, as it cuts off the oxygen supply to the affected area. The bacteria quickly begins to multiply and grow in the oxygen-free environment through the process of binary fission. During this stage, the bacteria secretes a highly toxic chemical called tetanospasm, which is a neurotoxin that is mainly responsible for the damage. The neurotoxin binds to the nerve endings and is transported across synapses junctions, and then it affects the neurons of the brainstem and spinal cord. Since the toxin blocks neurotransmitters, the calming signals are absent, so the muscles tense and become sensitive to outside signals such as touch, and this is when muscle spasms occur. Generalized tetanus is the most common form of tetanus in where people have muscle reflex spasms throughout the body. Localized tetanus is when muscle spasms occur near the infected area. Cephalic tetanus is when the Clostridium tetani bacteria is present in an ear infection called otitis media. Neonatal tetanus is when an infant gets infected by the umbilical cord passed down by their mother. The main symptoms of tetanus are muscle spasms and muscle stiffness. They affect the jaw, making it hard to chew, the throat, making it hard to swallow, the neck, making it difficult for the individual to move their head, and the chest, making it hard to breathe. Secondary symptoms include a fever, excessive sweating, a fast heart rate, hypertension, and headaches. The incubation period of tetanus is when the individual first begins to feel these symptoms. So how can we treat this disease? The first step is to care for the wound through basic procedures. Medications such as diazepam and chlorpromazine are given to control the muscle spasms. When diagnosed with tetanus, doctors will often prescribe the antibiotic penicillin or doxycycline to fight the bacteria and prevent it from releasing more toxins. When severe, tetanus antitoxin is injected to the person, which acts as a temporary form of passive immunity that will attempt to treat the tetanus. If the affected individual finds it very hard to breathe, they are put on an artificial respirator. However, tetanus can be prevented through the DTaP and Tdap vaccine. These vaccines work to prevent tetanus, pertussis, and diphtheria. They both contain inactive forms of the toxin, triggering the body to produce antibodies against the Clostridium tetani bacteria cells. However, the DTaP vaccine is given to those under the age of 7 and is to help the child develop immunity to these diseases at an early age when they are most susceptible to the illnesses. They will normally receive 5 shots of this vaccine during the time from 6 months to the age of 7. This vaccine should not be given to an infant under 6 weeks old, as they are too weak to handle the vaccine. The Tdap vaccine is a booster immunization which is mainly targeted towards tetanus rather than pertussis and diphtheria. This is given to children above the age of 11 and adults above the age of 19. The recommended dose is to get the booster shot every 10 years due to the fact that this immunity wears off. The Tdap vaccine is crucial for pregnant women to protect their newborn child from these diseases. Side effects of both vaccines include pain, redness, and swelling in the arm that was injected, seizures, mild fever, exhaustion, nausea, diarrhea, and headaches. From a social consequence point of view, if someone is vaccinated, they could potentially be helping build herd immunity in a community. When a pregnant woman gets immunized, they are creating what is called a cocoon of protection around their baby, which again prevents the disease from further spreading to a new host. When you have immunity to tetanus, you are able to have better health and therefore you are able to participate in more social relationships, thrive at work, and help your own family have a happier lifestyle. All of this will have a positive social consequence around the community one lives and even beyond that. Doctors recommend the Tdap and Dtap vaccine because it provides protection from serious diseases that could impact your social life. A negative consequence is that without the vaccination, there is a risk of death from tetanus, which can lead to a loss of a key member of a family. For example, the loss of a mother could deprive the child of a well-balanced home and school life, even sometimes leading to depression or anxiety, which obviously has a negative impact for the child's social interactions. A rarer risk of the Dtap and Tdap vaccine is that some people could suffer brain damage, which has been seen in children through previous years. This leaves them handicapped and unable to participate in fundamental activities in society for the individual affected and the family. Many pregnant women are now trying to avoid the vaccine as they are scared of the adverse effects it might have on the fetus, potentially preventing a new member of the family who would contribute to society from ever being born. I feel it should be compulsory to get the Tdap and Dtap vaccines regularly because the consequences of getting tetanus are more fatal than the potential rarer risks of the vaccines. Without the vaccine, there is a higher risk of potential death and is more likely that the virus will be easily transmitted to others. Overall, the actual disease will carry a higher price tag in terms of recovery than the actual vaccination itself.